COVID-19 has created global caregiver burnout to an extent, an extreme that I don't know that anyone ever thought was possible. Ironically, today I would be sitting in my house finalizing my slides for a lecture that I was asked to give a year ago. I was invited last spring to be the keynote speaker this spring at an event for caregiver burnout and physician burnout back in Philadelphia, which obviously because of COVID has been canceled. This morning when I got up, I looked at my MedPage feed, and Eric Topol wrote a really great article about physician burnout, and it was something that really hit home to me as a surgeon, because looking at the data in preparing my lecture, I was really overwhelmed and stunned by the number of people who really no longer love their jobs in healthcare. And I'm really fortunate because I have had a great job as a doctor. I've had a great career as a physician, and I found my calling as a breast cancer surgeon. So I've been able to stay kind of ahead of that wave of the burnout, but I still, as a healthcare professional, at times hit points of burnout where I have to go back and regroup to remind myself why I do what I do. And that usually comes back to the gratitude of the patients and the families. And I think one of the things that's happening right now with COVID-19 with the physicians is I hear stories about how patients are dropped off, the family members go, they never see them again. Doctors who've never met the patient are calling family members to tell them that their family member died. The families aren't allowed to be there with their loved one when they die. And the physicians and the nurses and the caregivers are left kind of holding the bag. They're there with all of that energetic stuff and don't really have a way out of it, a way to deal with it. And they can't even process it because they go home and they're back 12 hours later doing the exact same thing. And in New York, we still haven't even hit the peak. We're probably 2 weeks away. And that's really sad, and it's really scary, because the number of caregivers that will burn out through this process globally is going to be exponential. The number of caregivers who will lose their lives because either we don't have enough protective equipment and we're called to be in a place where we are asked to do things that most other people are never asked to do in the course of their careers. The article that I read today, though, was really telling, because it started out looking at American physicians in 2020. We're already in a deep state of burnout with the worst rates of clinical depression, suicide, and it was really a global epidemic. And before the pandemic became a part of this process, we were already dealing with a healthcare force that's stressed because we're being pulled between hospitals and insurance companies and patients and electronic medical records. And that was one of the things that I had really focused on in my lecture about physician burnout, is when your relationship is more with your computer, your iPad, than it is with your patient, and your eye contact is with your computer and not with your patient, you're missing that energetic connection of the human-human aspect. And that's another thing that COVID, there really is no human-human connection here, because the patients don't even see you. I wear a mask right now. I've had to wear a mask because I was away from my health system for at the time that we put a travel ban. And it's very funny because patients are like, could you just pull down your mask for a second so I can see your face? Because I want to see that you care about me. And these individuals are showing up in the hospital, never seeing the face of their caregivers, hidden behind all of the PPE, has got to be pretty scary. And the first phase that we kind of screwed up in the US, which, there are a lot of people placing blame, and they're placing blame about where the virus came from, how it came out. I don't know that we'll ever know. There's lots and lots of theories. Doesn't change the fact that we're in the midst of a global pandemic and a global crisis. So now we have to reframe all of this and say, how do we go forward? Yep, we were delayed in testing. There's no doubt about it. The CDC even admits it. Now the CDC says that they're suggesting that people wear masks. And the fact that so many Asian cultures were wearing masks because they had gone through SARS, and they knew that they could wear a mask and prevent them from giving the virus to someone else if they were an asymptomatic carrier. It's that simple. How vain are we that we don't want to wear masks? How much do we distrust people that we wouldn't say wearing a mask is good, thinking you're going to go out and hoard all the masks? This is a cloth mask. It was given to me by someone in my office, and it was fabulous because I didn't have one, and it's got a place for an insert, and I've been wearing it for 2 weeks, and I actually bought new inserts, and now I gave the pattern to some of my patients who are going to be sewing masks as well, so they can do something for us. But in the meantime, all of the things that are going wrong with this process, we have to look at the countries that are doing things that are right. And I think that we have to kind of go back to a place where we take care of our caregivers. And there's a lecture that I've given many times called Caring for the Caregivers, how we take our patients from just surviving to thriving, but we have to do it for ourselves. We've got to give ourselves the oxygen first. So I'm trying to learn from other countries, other providers who've gone before us, before the wave hits us. It's not safe to care for patients with COVID without protective equipment. Running in to code somebody who's having a cardiac arrest, if you're not adequately protected, puts you in harm's way. And if you die from this, you're of no service to humanity going forward. I tell this to my patients all the time, that when they get cancer, I ask, who's the most important person in the world? And we have to become centered on self, not self-centered, centered on self, saying we've got to protect ourselves so that we can take care of others better. So for physicians, nurses, anyone in the first line, when you're out of the hospital, you've got to take time to recharge. You've got to eat healthy, eat foods that nourish your soul, get sleep. It's very, very hard sometimes to sleep because I know I've heard my friends replaying the ticker tape in their brain of all the things they did that day. And it's very hard to put the past in the past and move forward. I use a meditation. I have uploaded it to my website. It's called a Yoga Nidra. It's 19 minutes. It's very easy. It helps you to take the focus outside of your head because you can't be in two places at once. Getting as much sleep as you possibly can and protecting your family. I know that for a lot of my colleagues, they're afraid to go home because they don't want to infect their families. Their kids have health issues. And I've seen several posts from physicians who are in two physician families where one of them quits their job because they're the only ones that their kids have to take care of them. And they're feeling very guilty about quitting their job. But on the other hand, they've got to also look at who's going to be there for their kids if something happens to both parents. I've watched posts of young doctors planning for what would happen if they don't survive this pandemic. They're not going back to work. They're just being realistic that this is a real deal. And we don't know who's living and dying yet. We know that people with comorbidities have a higher risk of dying. We know that people that are obese and have hypertension and diabetes and asthma are at higher risk. But there's still a lot of very, very healthy young people dying from this disease, which is why it's so important for all of us to do our part and wear the masks to protect anyone from getting COVID from us, God forbid if we have it. I think that the isolation factor for these physicians, because they're isolating, they're not able to decompress. Whenever we go through a stressful time as physicians, you know, when I work in medical missions in Haiti, every night we would sit around the group and we would have a decompression time where we could talk about how difficult things were that day. And we're able to talk to our coworkers and share those experiences. But right now, this is like where the front lines are happening over and over and over again. So it's constant stress on top of stress on top of stress. So the level of PTSD and the amount of healing that's going to have to happen for our healthcare providers that are here when this pandemic ceases is going to be something that we've never seen before. Knowing that we can't resuscitate a lot of patients, knowing that we're not playing God. We don't get to choose who lives and dies. We get to show up and do the very best we can for each and every patient. So the most important thing through all of this is if you're a healthcare provider, take time to take care of yourself. Listen to a meditation, find a way to decompress, find a way to pull yourself out of the daily grind and give yourself a chance to regroup. If you can, get outside, breathe the fresh air, touch the earth, do something good for yourself, stay protected. Don't go in rooms without PPE. Make sure that you remember to take care of yourself first, because that way you'll be here a lot longer to take care of those that love you and those that you love. Thank you.